Okay. So, hi, evening friends, evening everybody, bache, evening everybody. Let me give 10 seconds for everybody to join in and let's start. So, okay, let me open up the YouTube sessions also so that I know what you are commenting. So, hi, evening friends, evening everybody. And yes, it is great to see all of you again. Pooja, Swati, Tanya, Savan, Ashi, Shubhika, Aditi, everybody, bache, everybody. So, let's start. Let's start with our microbiology set of sessions. So, I know you have had good, great, refreshing surgery sessions which just ended. So, Ishika, it always feels nice when you say welcome back. Seriously. So, Lucky So is seeing you, those. So let's start. Let's start with microbiology. Now, microbiology and pathology, they are actually very closely linked with each other. I am saying so because थोड़ा सा wavy आ रहा है, I guess. Just a sec. Yes, now it is okay. So, firstly, path and microbiology, they are very, very closely linked with each other. And irrespective of the paper, path plus micro combined, I don't know why, but it is being given undue weightage in the dental subjects with close to 18 to 20 questions coming from these. Even in INI exams, you have a lot of questions which come from micro. Microbiology, we divided into 4 or 5 main topics. That is general microbiology, very, very important, followed by bacteriology, mycology, parasitology, and virology. So, the main topics, as we go further and as we keep on doing stuff, I'll be telling you these are the main important points, these are the PYQs, and so on. But mycology, virology, and general microbiology, these are our 3 main units, firstly. Secondly, don't say that. Oh, I'm in studio, yaar. Uh, uh, started, dosto. Uh, Wait, let me ask team. Now okay. कब से stuck थी video? Now it is okay. I always love hearing now okay actually. So कब से stuck थी? मतलब were you able to hear कि content is going to be gold standard firstly. Secondly, all the questions, I'll quickly, just within 10 seconds, say what I had just said. It is absolutely the same for the past 2.5, 3 years, and I'm saying it proudly because all the questions that have been asked, including 17 questions from mycology that were asked in INI, were from notes only. So, notes are going to be your gold standard. Thirdly, bache, micro is much more factual as compared to path, which was understanding based. So you will need to revise the content in micro much more. So on this note, let us start with our first topic in microbiology, that is starting from our first unit, that is we'll start from general microbiology and extreme basics in this, that is introduction of the same. Now, there are 3 or 4 chapters in general microbiology, the introduction, then are the morphology of bacteria, then we'll go on to spore formation, then we'll have a look at culture media and so on. So, starting with extreme basics, who is the father of microbiology? That is Louis Pasteur. Louis Pasteur, bache, he is called as the father. He is the father of microbiology. And he is the one who proposed the fermentation principle. He is the one who proposed fermentation principle. Next, I know few factual points, especially in this chapter. Next, he also disapproved dysbiogenesis theory. He disapproved abiogenesis theory. Abiogenesis theory, it said that life forms they can originate from non-living things also. But he disapproved abiogenesis theory. He said that all life forms have to originate from their own like life forms only. ऐसा नहीं है कि if banana is kept on the table and then we see flies, so flies came from the banana. No, not at all. So he disapproved the abiogenesis theory, and then he also introduced sterilization techniques. He introduced the sterilization techniques, which is one of the best sterilization techniques that is still used. That is autoclave, hot air oven, autoclave, hot air oven. Everything, the basic principle was given by Louis Pasteur only. Next, extremely important, he gave us the vaccines for cholera, anthrax and rabies. He gave Jesh, अभी देखो first session is YouTube, तो कुछ भी नहीं. He gave the vaccines for cholera, anthrax and rabies. Acha, with respect to rabies, at least those of you who are in Delhi know this extremely well, that I know Delhiite Muskan, because Muskan was supposed to give me muesli also. And I only went and started searching what the hell is muesli. And somebody was telling me, sir, don't worry, it is very economical, this, that. I was not able to find it at Manish agencies, but it was there at Reliance Mall, costing around 650 per 500 grams. Oh my god. And मैंने ली नहीं, I didn't take, but I just saw it was a mixture of all dry fruit, this, that, whatever. Sioli was also talking about muesli, ki we have muesli in breakfast. So all girls, you're into, I have bananas in breakfast and I'm okay with it. Next, so coming back, talking with respect to how we were talking of rabies and dogs. No double meanings. So Supreme Court has given this कि हाँ 400, Saurabh, I agree. वो उसमें Supreme Court has given this ruling that all dogs in Delhi has to be removed. अब पता नहीं कहाँ डालना है उन्हें. But thing is, this is asked, the first vaccine for rabies, first vaccine was given to, I was remembering you at that point, Sioli, especially when I saw the rate. Yes, Namrita, bang on right. Now, coming back, rabies, the first vaccine for rabies was given to Joseph Mister. So, this becomes important, especially in today's time, what is going on and so on. So, this is with respect to Louis Pasteur, and this is how Louis Pasteur looks like. This is Louis Pasteur. Let me write this for you. He is Louis Pasteur. Next, father of modern microbiology. Father of microbiology is Louis Pasteur. Father of modern microbiology being Robert Koch. He is Robert Koch. So, Robert Koch, he is the father of modern microbiology. Let me write this for you. So, this gets us to Robert Koch. Robert Koch, the Koch's postulates, again very, very important. We'll just see that. He is the father of Lucky. He is the father of modern microbiology. I so missed you guys, yaar. Seriously. And लाकी ने तो टेलीग्राम पे अपनी एक सेक्सी सी फोटो भी डाली है. मतलब इमेजिन मी बीइंग अ गाय इज फाइंडिंग हिज फोटो सेक्सी, सो ऑब्वियसली ऑल द गर्ल्स विल. But for all the girls, he is committed and has a nice girlfriend. So, Robert Koch is the father of modern microbiology. What is important with respect to Koch are the Koch postulates. They are Koch postulates which said that organism should be associated with a lesion. सबसे पहले it said organism should be constantly associated. Organism should be constantly associated with lesion. Next, meaning if a patient has a disease or a lesion, organism should be constantly associated with it, and it should be possible to isolate the organism from that lesion. Very commonsensical. It should be possible. It should be possible to isolate organism. To isolate organism in pure culture from lesion, in pure culture from the lesion. ठीक है, agreed. So organism should be associated with the lesion. it should be possible to isolate the organism from the lesion. Next, this isolated organism. Namrata, ऐसे मत बोलो, because when we say that, some kids actually find it true कि we'll study till 11:30, तो ऐसा कुछ नहीं करेंगे. Now, what we have seen is organism should be there with the lesion. It should be possible to isolate the organism from the lesion. Now we have isolated it. When I put this isolated organism in a susceptible individual, he should develop the disease. This isolated organism, when put in lab animal, should lead to similar disease, should cause a similar disease. And lastly, when this lab animal got diseased, it should be possible to re-isolate the organism from it. So we are double checking it. जो diseased था उसमें से organism को isolate किया. You put the isolated organism in a lab animal, and now it should be possible to isolate the organism again from that diseased lab animal. It should be possible to re-isolate the organism from diseased lab animal. These are the Koch postulates. All the organisms, they follow Koch postulates, except very, very important Koch postulates, which they are followed by all. They are followed by all except Mycobacterium leprae. Important है, पूछा जाता है. When we will study Mycobacterium leprae, we will see that it is not possible to grow it in pure culture. We use the foot pad of armadillo. We'll study that. Mycobacterium leprae and syphilis, that is Treponema pallidum. We'll be doing this in extensive detail. Very, very important. All the organisms follow Koch postulates except Mycobacterium leprae and syphilis, that is Treponema pallidum. This was about Robert Koch. Robert Koch, other than giving the Koch postulates, so nothing is to be memorized till now. Koch postulates, we double check. If you just know double check, you will know everything about it. He also discovered TB. Cholera. The cholera bacilli, and proposed the hanging drop method. What do we mean by hanging drop method? देखो बच्चे, the name itself tells you. We take a slide, and on its lower end, we let a drop to hang. So if a drop is hanging, the organism will be motile in it. So hanging drop method is used to check for motility of organisms. It is used to check for motility of organisms. And lastly, he also gave the solid media concept. That is, what we mean by solid media? All this agar gel, blood agar, chocolate agar, all these are solid media. So he gave the solid media concept. So father of modern microbiology, that is Robert Koch. Next is, who gave acid-fast staining? That is Paul Ehrlich. Next is Paul Ehrlich, who talked about the acid-fast staining. Acha, I am again saying this. I know your first thought will be कि eco आ रहा है. Yeah, there should be no eco. I'm in studio actually. So starting with acha, let me check. So coming back, is there an eco? Just give me 1 second and let me talk with the team with respect to eco. Eco आ रहा है यार. Okay, so coming back. Okay, so coming back to this, Paul Ehrlich gave us the acid-fast staining. He gave acid. So there are three main stains when we talk about microbiology. They are the Zn staining, Z-Nielsen staining. Next, acid fast staining, and next we'll talk with respect to Corynebacterium diphtheria, the stain used. We'll see that. We'll see that. So Paul Ehrlich gave the acid fast staining. Next, he is also called as father of chemotherapy. He is also called as father of chemotherapy. Father of chemotherapy. Why do we say him as the father of chemotherapy? Because he introduced the concept of magic bullets. Magic bullets, which they were arsenic coated compounds. Arsenic is chemotoxic, but these magic bullets, he used them against syphilis. He used them against syphilis. Later, it was found out that we can use arsenic or arsenic associated compounds in chemotherapy also. So that is why he is called as father of chemotherapy. Next is Joseph Lister. With respect to the next scientist is Joseph Lister. Joseph Lister, who is the father of antiseptic surgery. So even basic points, for even basic points, that is washing hands before surgery, something that is extremely basic, or while going from one patient to another, if you have operated on a patient, or even if you have done minor dental work on a patient before going to the other, you have to change your gloves, wash hands. These things were not performed earlier. So and there was a lot of people who cursed the guy ki this is not needed, this, that. Even basic hand washing was not performed, and he was being cursed. So world is full of stupid people, and once they are proven right, that is when they become father of antiseptic surgery and so on. Even educated doctors, if you read about this, even educated doctors were not willing to wash hands before surgery, saying कि हम लोग तो नहा धो के आते हैं, our hands are clean only. Why should we wash the hand before surgery? We are semi-gods. We don't need to do that. He did studies to prove that doctors who washed their hands versus those who didn't, so washing hands reduced the risk of post-op infections. He had to prove something this basic with studies. So he's the father of antiseptic surgery, Joseph Lister. Next, but it is called as magic bullets because arsenic. They are arsenic-coated compounds. Arsenic is used. Uh, Arsenic is used as a chemotherapy drug also. So that is why he is the father of chemotherapy. Magic bullet इसलिए कहा गया था because earlier the mortality rate with syphilis was close to 100%. You need not know all these background information or history with respect to this. Syphilis had a very high mortality rate, especially in loyalty, because loyalty as such, kings or queens or whatever, they were multisexual. So syphilis was very common. So when this arsenic coated compounds were used, syphilis got cured. So it was used the word magic bullets. Need not know that. Next, who is the father of microscopy? Who even coined the term little animals? That is Antony von Leeuwenhoek. Next is Antony von Leeuwenhoek. Antony von Leeuwenhoek, who is the father? Who is the father of microscopy? Let me write this. Antony von Leeuwenhoek is the father of microscopy, and he coined the term. He coined the term little animalcules. He coined the term little animalcules for microorganisms. Fair enough. Fair enough. Lastly, father of vaccination, Edward Jenner. Father of vaccination. Which disease is eradicated now? Father of vaccination, that is smallpox. Edward Jenner, who gave vaccine to us against smallpox. You know this well, smallpox is eradicated. He gave us the smallpox vaccine. Next, we'll see Corynebacterium diphtheria. We'll do it in detail. That is called as Klebsiella bacilli. Agreed, agreed. Next, lastly, let me write one more. Pfeiffer's bacillus. Pfeiffer's bacillus is Haemophilus influenzae. Pfeiffer's bacillus is Haemophilus influenzae. Acha, tell me this. I'll be very impressed if you tell me this. Which hemolytic anemia increases the risk of infections with Haemophilus influenzae? I know slightly an integrated micropath question, but which hemolytic anemia increases the risk of infections by Haemophilus influenzae? Answer. Name the hemolytic anemias. Hereditary spherocytosis, G6PD deficiency, sickle cell anemia, thalassemia, PNH, and autoimmune hemolytic anemia. Remember, these were the 6 hemolytic anemias. In which hemolytic anemia? Bang on right. Vidushi, Ayush, Ruhani. Very nice. Very nice. Sickle cell anemia is associated with autosplenectomy, which increases the risk of infections by encapsulated organisms. That is strep pneumonia and Haemophilus influenzae. Perfect. Perfect. Very nice. Okay. Okay. So, guys, let's restart where we had left off. Let me see if it's working fine or not now. ये क्या हो रहा है? Okay. Okay, let's start. Let's start where we had left off. So starting with, and I actually feel like we started the session early today at 5:30, thinking कि आज तो बहुत सारा content cover कर देंगे, मतलब फोड़ देंगे types ना. But we had two technical issues, but ठीक है, it's एक अच्छा माना जाता है. At least on first day of the class, if there are 1-2 technical issues, the class goes smooth. We'll not have any other technical issues from this point onwards, hopefully. Firstly. Secondly, uh, actually, yeah. So coming back, let's start with this. And that was so nice and cute कि वो कैसे नाम and phone number कैसे हटेगा. I was just reading your previous messages. दोस्तों, you will not be able to remove that thing from this. So starting with मैं नहीं रुका हूँ यार, please tell me everything is working fine. Now it is okay, the connection is okay, everything is okay. So let's start. We divided microorganisms into two broad categories, that is prokaryotes versus eukaryotes. Prokaryotes, they are simple organisms, so nuclear membrane is absent, nucleolus is absent. They have a single chromosome. They have a single chromosome, that is chromosome is only one, and they divide by binary fusion. They divide by binary fusion. Versus eukaryotes, which have a nuclear membrane, which have a nucleolus, they have more than one chromosome, and they divide by mitosis. So prokaryotes are simple, straightforward organisms. In the cytoplasm, in prokaryotes, everything is absent. That is mitochondria. What all is present in cytoplasm? Mitochondria, Golgi apparatus, endoplasmic reticulum, lysosomes. All these are cytoplasmic organelles. They are absent in prokaryotes versus present in eukaryotes. And lastly, the chemical composition. Chemically, the only point that you need to know is muramic acid is present in prokaryotes. Muramic acid is present in prokaryotes versus absent in eukaryotes. This point is important. I'm not concerned with the fact that sterols, they are absent in eukaryotes versus they are absent in prokaryotes versus present in eukaryotes. Eukaryotes had everything. They had everything. Was the only differential point is muramic acid. So जो भी different होता है, whatever is different, that is the point need to be noted and remembered. Muramic acid is present in prokaryotes. And which are the examples of prokaryotes? That is bacteria and blue-green algae. All bacteria are prokaryotic. Bacteria and blue-green algae. It is only the blue-green algae which is prokaryotic. Versus fungi, all the other algae, protozoa, and slime molds, which are eukaryotic. ठीक है, fair enough, nothing major. So we can, first way of differentiating microorganisms was into two broad categories of prokaryote versus eukaryote. Next, we can also divide them into four main headings, that is viruses, bacteria, fungi, and protozoa. This is what we'll be studying throughout microbiology, that is virology, bacteriology, mycology, and protozoology. These are the four units of microbiology. So starting with nucleic acid, viruses, they have either DNA or RNA. We will see some are DNA viruses, hepatitis B, HPV, they are DNA viruses. HAV, hepatitis A, C, D, they are RNA viruses. So they either have DNA or RNA. Versus others, bacteria, fungi, and protozoa, which have both. They have both DNA and RNA. Next, nucleus. Nucleus is absent in viruses. You already know bacteria are prokaryotic. That is, they have a nucleus, but nuclear membrane is absent. They have a single chromosome and divide by binary fusion. Versus fungi and protozoa, which are eukaryotic. Versus fungi and protozoa, which are eukaryotic. So similarly, I can safely say that mitochondria is absent in viruses and bacteria versus present in fungi and protozoa. Very obvious. Bacteria are prokaryotic, so mitochondria is absent. Viruses बेचारों में तो वैसे ही कुछ नहीं था. Lastly is the outer surface. Lastly is the outer surface. Viruses have a capsid versus bacteria, which have a rigid wall made of peptidoglycans. they have a rigid wall. They have a rigid wall which is made up of peptidoglycans. Made up of peptidoglycans. Fungi have chitin. I'm sure we know this from 11th, 12th mycology also. They have chitin versus protozoa, which has a flexible membrane. Versus protozoa, which have a flexible membrane. So this is the master table of organisms. That is, we subdivided them into viruses, bacteria, fungi, and protozoa. A very obvious table. I am pretty sure none of us will be going wrong in any of the question asked from this table. So this starts us with basic concepts of microscopy. देखो बच्चे, whenever we talk of microscopy, we talk of three basic things. First is magnification. Magnification of a microscope. When we see a microscope, I'm sure all of us would have seen microscopy in our colleges. कौन सा microscope होता था? Which microscope did you have? A single eye one या double eye one जिसमें नीचे से light on होती थी? We used to do light on off. We used to try seeing it like this. Then we used to close one eye, look at it. कौन से वाले से देखते थे कॉलेज में? I'm very curious. So microscopy, we have something जिसको हम ऐसे देखते हैं. We look at through the eyepiece, and there are four lenses which we rotate. These are direct questions, बच्चे कुछ सोचना ही नहीं है. Single eye. I know many colleges, yeah, some have double eye. Double eye microscopes are obviously on the expensive side. Single eye are much cheaper. Plus, even double eye microscopy, we used to close one eye and look by one only. So this is the eyepiece that has a magnification of 10x, and then is the objective lens. Then is the objective lens, the one that we used to rotate, 4x, 10x, 40x, 4x, 10x, 40x, and 100x. So what is low power view? What is low power? 10x. So what is 4x? But it is the scanner view. What is high power? 40x. So what is 100x? That is oil immersion. We saw the same thing in pathology also. This is what we see in microscopy. So if somebody asks you, what is the magnification of high power? If the question is asked, what is the magnification of high power? Our answer becomes 4x, 10x, 40x or 400x. What will you mark? What is the magnification of high power? I'm waiting for your answer on this. Next, the next basic term is resolution. Next is resolution. Harshita, Lakhi, Ayush, good. Bachef, Bishal, agreed. It is 400x because 40x is high power. That is the power of high power lens. The power is 40x, but when we talk of magnification, eyepiece was 10x, so we always multiply it and the magnification becomes 400x. So see the language of the question very carefully. Next point. So when we are talking of microscopy, first is magnification. The next is resolution. What do I mean by resolution? It is the ability to distinguish between two points as separate. Ability to distinguish two objects as separate, meaning you are clearly able to see that these two dots on the phone are separate from each other. Hi, evening Tanvi, evening Bache. These two dots are separate from each other. So we are able to resolve it. But suppose somebody is standing 50 feet away or 100 feet away, he will just be able to see this board probably and nothing else. He will not be able to appreciate that these two dots are separate. So that is the resolution power. Human eye has a resolution power of 0.2 millimeter. Easy to remember, we have that scale now. Scale is the least unit on scale is 1 millimeter. We can see 1/5 of that. So human eye has a resolution power of 0.2 mm. Better than that is light microscopy, 0.2 micrometer. And best is, of course, electron microscopy, that is 0.2 nanometer. So nothing to remember. Obvious tha. Least on scale is 1 mm, so 1/5 of that. Human eye is 0.2 mm. Light microscopy 0.2 micrometer. 1/1000 decrease हो रहा है. Electron microscopy 0.2 nanometer. So this is about microscope, magnification versus resolution. So let us see with respect to various types of microscope, starting with phase contrast microscopy. Starting with phase contrast microscopy. The name tells you everything. We are differentiating the thickness. फेज अलग है ना, फेज को कॉन्ट्रास्ट कर रहे हैं. सो इंटरनल स्ट्रक्चर्स ऑफ द सेल, they differ in thickness. Now, differ in thickness is a very non-technical term. If I have to use a medical term, that is, they differ in refractive index. Thickness alag hai, so they differ in refractive index. What do we mean by this? देखो बच्चे, when light passes through an object, it emerges in a different phase depending upon the refractive index of the object. We know this from 9th, 10th class physics also, that when light is passing from oil that is floating above water, so when it is passing through the oil, वो थोड़ा सा bend हुआ, and when there is oil water barrier, because the refractive index is different, it bends at a different angle. So when light is passing through an object, depending upon the refractive index, it emerges in different phases. So this is the principle of phase contrast microscopy. It is used to see internal structures of the cell. The phases were contrasting, thickness was different. Next is dark field microscopy. Dark field microscopy. See, with respect to microbiology, understand the name of the term and you will not forget it. Dark field means the name tells you that the background is dark. Field dark hai na, the background is dark. Like some people's heart, it is a totally dark background, and we see the self-luminous microorganism against a dark background. We see a self-luminous microorganism against a dark background. So which self-luminous organism comes to your mind जब dark field की बात हो रही है? काला दिल है ना, dark field है, काला दिल है. So syphilis. When we study syphilis in detail, let me see spirochetes. Agreed. And this is capsule demonstration and all. I do not have syphilis image with me in this, but we'll do it in extensive detail. I'll show it to you that the whole background is dark. The organism was spiraled. It is spiraled corkscrew organism, corkscrew shaped organism. That is spirochetes. Next. That was dark field was 2 minutes ago on our screen, Abdul. Good one, those. Next is interference microscopy. Next is interference microscopy. Interference microscopy, बच्चे, this is used for revealing cell organelles. देखो, बहुत ज़्यादा interference है. There is too much of interference. So अंदर की बात भी पता चल जाती है. For the Hindi speaking, it is used for revealing cell organelles. I always say this. Aditi बच्चे, phase contrast कुछ भी नहीं है. Just white. Dark field microscopy, the organism is self-luminous. That is, it appears white in a dark background. Aditi, बच्चे, phase contrast कुछ भी नहीं है. There is nothing to explain. The phases are different. So when light is passing through a thicker object versus a thinner object, the refractive index of the object will be different, na? So it will come out in various phases. Simple. This is phase contrast microscopy. It is using difference in thickness, that is difference in refractive index. Next. So interference microscopy. There is so much interference के अंदर की बात निकल रही है, reveal cell organelles. I always speak this, teach it this way, because then the recall will be much higher. There is no doubt about it. Next, it is also useful for quantitative measurement. It is useful. It is useful for quantitative measurement of cell constituents. सो अंदर की बात पता चल रही है, सारे सेल कॉन्स्टिट्यूएंट्स कितनी क्वांटिटी है, सब कुछ. दैट इज लिपिड्स, प्रोटीन्स एंड न्यूक्लिक एसिड. लिपिड्स, प्रोटीन्स एंड nucleic acid. That is interference microscopy. So first thing, when we think of interference, think with respect to cell organelles. Next is fluorescent microscopy. वैसे I'm very curious, I know we are still on YouTube only, we have not shifted to our app, but I'm very curious, who all think that your moms are way too interfering and you should get slight more space and freedom? Those of you who think so can just write me, others can say no. I mean, obviously I'm very curious on this question कि moms are way too interfering, कि नहीं ऐसा नहीं वैसा नहीं types. So that interference microscopy reveals cell organelles. Next is fluorescent microscopy. Fluorescent microscopy, which is, this is again important. What this tells us is when UV rays no, किसी की भी नहीं है. अरे वाह. Okay, you guys, मतलब your parents will be so proud reading all this. No, because you guys are great children, yaar. They will be super duper proud. Unlike my mom, I guess. But coming back to this fluorescent microscopy, हाँ ठीक है, I've understood. कोई yes नहीं आया. Okay. भी फ्रीडम नहीं. हाँ, अपराजिता, fair enough. Rajita, I'm sure she would be pushing you for a second child now. हाँ, this, see, love her a lot. So Aditi ऐसे लिख रही है, like the remaining of us, whosoever would have said yes, hated their moms. Oh, हाँ, Chris, thank you. I was feeling so left out and stuff. Chris ही मेरा दोस्त है यार. So we all love our moms, but ठीक है, समझते हैं. So coming back to this, what do we mean by fluorescent microscopy? फ्लोरेसेंट माइक्रोस्कोपी, हाँ ना, सिबलिंग्स की तो हम बात भी नहीं करेंगे अभी. when see what happens is when UV rays fall on an object, fall on a fluorescent object, the light is reflected back which has a higher wavelength, that is fluorescent. Aditi, wow, blessed, dear blessed. when UV rays fall on a fluorescent object, when UV rays fall on a fluorescent object. I still remember, normally I love eating bananas. I don't know why. I mean, I know it's not a fancy fruit, but I'm into bananas. I usually have one banana. I was going to draw a banana, but then I thought, let me not draw it. One fine day I thought, let me have two. And she questioned me on that कि second वाला किसके लिए लेके जाया जा रहा है. But coming back to this. So, fluorescent. When UV rays fall on a fluorescent object, the light that is reflected back is of higher wavelength. So the fluorescent object emits light at a higher wavelength, that is at a longer wavelength. So remember that 11th, 12th class physics, longer is the wavelength, less is the energy. So when light is hitting a fluorescent object, obviously some energy will be lost. Na? That is why the emitted light is of higher wavelength. And this higher wavelength becomes visible light. This is visible light. This is visible light. That is fluorescent microscopy. Next point. Very important, the fluorescent stains. And this was a recent NEET MDS PYQ also. For Mycobacterium TB, बच्चे we use rhodamine or amine stain. For Mycobacterium TB, we use rhodamine or amine stain. Whereas for fungi, we use chalcofluor white. Fungi, chalcofluor white versus DNA. Yeah, we have no idea. Versus DNA or nucleic acid, for which acridine orange is used. For which acridine orange is used. So this is fluorescent microscopy, the fluorescent stains. That is Mycobacterium TB, rhodamine, oramine stain, fungi, chalcofluor white, and nucleic acid acridine orange. Actually, tell me this. Uh, KF ring in the eye. What was the name of the stain? Name of the stain, inheritance, gene mutation, chromosome. You have a patient, you have a 46-year-old patient presenting to OPD with presence of KF ring, Kayser-Fleischer ring in the eyes. Just give me a sec. What is it? It is okay. So coming back, Wilson's disease, KF ring, Kayser-Fleischer ring, Wilson's disease, ATP7B gene mutation, chromosome 13, autosomal recessive, copper. Agreed. Namrata Ruhani agreed. What was the name of the stain for copper? Rhodanine stain. Rhodanine. So do not confuse rhodamine or amine stain of Mycobacterium TB from rhodanine stain of copper. We have done that. Next, so this was fluorescent microscopy. Next is electron microscopy. Again, with respect to pathology, we did the various fixatives. Fixative for light microscopy, 10% formaldehyde. For electron microscopy, we use the fixative as glutaraldehyde. Glutaraldehyde. You know this. Next, electrons are used. Electrons are used instead of light. Electron microscopy, so obviously beam of electrons are used, and this beam, it is targeted with the help of circular magnets. It is targeted by circular magnets, and it also uses vacuum. This is electron microscopy. नहीं बचे नहीं, सप्तर्षि नहीं. Limit yourself acridine orange, DNA, nucleic acid. Next, so ये कुछ भी नहीं था. KF ring, Kayser-Fleischer ring, path बचे. We did it in pathology. Autosomal recessive. It is excessive deposition of copper in the body, and for copper we use rhodanine stain. So Mycobacterium TB, rhodamine or amine stain. Copper, rhodanine stain. That was what I said. These two options usually are given together in the question. First class. So this was about basics of microscopy. So this starts us with study of bacteria. This starts us with study of bacteria. We can study bacteria either by unstained or a wet preparation. We can study bacteria by unstained or wet preparation. If it is a wet preparation, जैसे वो hanging drop method था. Namrata, I guess you were asking me about hanging drop method. It was nothing but a slide पे we leave a drop hanging and we see it under the microscope. अब वो drop hanging है ना, तो it is used for checking the motility of organisms. So it's a wet preparation, like hanging drop, like the hanging drop method, which is used to test for motility of organisms. You know that. Next, you also know dark field microscopy. It is an unstained preparation. We are not staining it by anything. Dark field microscopy, which is for syphilis, that is, it is for treponema. You know this, it is unstained. Next, acha, one more thing. With respect to microbiology, always think if a question comes from this, whether I will be right or not. So do not think of memorizing we can study the bacteria firstly by unstained method, then we can use simple stains, then negative stains, then special stains. Nobody is going to ask you to write a subjective answer. See, we have to target the paper. It is an MCQ based paper. The right answer will be there in front of you. You just have to apply that knowledge. Answer is there in front of you. So study accordingly. That's all I want to say. We can use simple stains. That is the use of extremely basic dyes. Basic है ना, so blue color आएगा, that is methylene blue, or basic fusion, methylene blue or basic fusion. These are the simple stains. Next is the use of negative stains. Next is negative stains. What do I mean by negative stain? That is India ink or nigrosin preparation. Very, very important. In negative staining, bache, the background is stained. The background is stained and we demonstrate the bacterial capsule. This is used for demonstration of bacterial capsule. This is opposite of dark field microscopy. In dark field microscopy, the background was dark. Organism was self-luminescent, it was white. That is dark field microscopy. In negative stain, the name is telling you that negative stain hai. That means the background is stained. This is India ink or nigrosin preparation. That is the background is stained and we are demonstrating the capsule. It is used for demonstration of the bacterial capsule. That is India ink or nigrosin. Perfect. We'll be seeing that. We'll see this in extensive detail. Next is the use of impregnation methods. Recent NEET MDS PYQ. We are impregnating the organism. You impregnate the organism because it was too thin. That is, it is used for demonstration of flagella. It is used for demonstration of bacterial flagella and spirochetes. We are impregnating it. Kisse? By silver. We are impregnating it by silver, ताकि it becomes slightly thicker for demonstration of bacterial flagella and spirochetes. This is with respect to staining methods. So unstained or wet preparation, then there was use of simple stain. Negative stain, background को stain कर लिया for demonstration of bacterial capsule or impregnation methods by silver. And lastly, and the main point, is the use of differential stains. Lastly, and extremely important, is the use of differential stains. Very, very important. Whole microbiology is based on gram positive versus gram negative bacteria. So we'll talk about three main differential stains. That is gram stain. There are three main differential stains. Gram stain, acid fast staining, AFP positive, Mycobacterium TB, Lepre, Nocardia, all Zn stain, AFP or Zn, Z-Nielsen stain, and lastly Elbert stain. We'll be talking about these three differential stains one by one. Let us start. How is it negative? Both are dark. नहीं बच्चे, Pratisha, in dark microscopy, the background is, in dark field microscopy, the background is dark. Organism is colored. It is self-luminescent, it is white. Background was dark. In negative staining, the background is stained. It is not dark. Dark तो काला होता है ना. In negative staining, the background is stained. The bacterial capsule was visualized against a stained background. This is Indian ink or nigrosin stain, negative stain. Next point. So let us start with our first main differential stain, the one which is most commonly used, that is gram stain. Gram stain, last year's NEET MBBS PYQ, not MDS segment, so it can easily be asked in your paper also. MBBS PYQ was the steps of gram staining. Now, heat fix smear. सबसे पहले, when we see this, when it's fair enough. Now, where was I? Gram staining. When a slide is to be made, we heat fix the smear. Heat fixing of the smear means organism is on it, Bunsen burner on key, and we slightly just do it this way. We don't keep it, we don't burn the organism, nothing like that. We just heat fix the smear. Heat fixed smear is stained by crystal violet. It is stained by crystal violet. So violet, crystal violet, which is, this is the primary stain. We stain it with crystal violet for 1 minute. For 1 minute. Then we put grams iodine on the slide. We pour grams iodine. Pour grams iodine again for 1 minute and decolorize with acetone. And decolorize with acetone. Then we counter stain. So which is the decolorizing agent used? Acetone. Which is the primary stain? Crystal violet. Then we counter stain with red color. Counter stain is saffronin. Counter stain is saffronin. So you tell me. Now think of it very obviously. If the organism is gram positive, meaning it will not get decolorized, so it will be violet in color. If it is gram positive, it will be violet. It did not get decolorized. That means it will have a thick cell wall. Versus if the organism has a thin cell wall, meaning it will get decolorized with acetone. So in that case, the organism will be gram negative. So it will be red in color because it will take the counter stain saffron. Now tell me this, which is the main step? I'll be very impressed if you give me this right answer. Which is the main step for gram stain? Primary stain, decolorizing, secondary stain. These are your three options, 1, 2, 3. Which is the main step? Forget it, Vishal, not interested at all. Which is the main step in gram staining? Primary stain, decolorizing, or secondary stain or counter stain? Next, so I can safely say that the principle of gram stain is permeability of cell wall. I can safely say that the principle is permeability of the cell wall. You guys, majority of you are right. नहीं बचे, Shubhika, no, Aditi, no, थोड़ा सा गड़बड़ हो गया. It is not primary or the counter stain. The main step is decolorizing with acetone. This is the main step. If it gets decolorized, it is gram negative. If it retains its blue color, it is gram positive. This is again a question. Simple, straightforward. So the whole principle of gram staining is permeability of cell wall. More as gram positive, if the organism is gram positive, then the cell wall is less permeable because it did not get decolorized. It has more acidic protoplasm. It has more acidic protoplasm, so it retains the color. It retains the color. And the second principle is integrity of cell wall. There are two main principles, permeability and integrity. Now think of it this way. Method, Sakshi, I'll repeat. Shrija bache, I'm not concerned with iodine at all. It fixes the dye in the cell wall. Shrija, Charukri bache, iodine, I know somebody asked earlier about iodine also. Let me write this here only. Iodine, this fixes dye. It fixes dye in cell wall and it makes the protoplasm acidic. Nobody is going to ask you this, not concerned. जो main points है ना वो समझो. So Ishika, bache, I'll repeat it for you. What you asked me was, नहीं Ishika नहीं, sorry, Sakshi asked me that प्राइमरी स्टेन सबसे पहले ब्लू कलर डाला. साक्षी अपन हिंदी में बोलेंगे, हिंदी ना समझ आती है, इंग्लिश समझ में ही नहीं आती यार. सबसे पहले ब्लू कलर डाला, दैट इज क्रिस्टल वायलेट. उसको डीकलराइज किया विद एसीटोन एंड फिर काउंटर स्टेन डाल दिया रेड कलर सैफरन। इफ ऑर्गेनिज्म डीकलराइज नहीं हुआ तो ब्लू कलर रह गया, दैट इज इट इज ग्राम पॉजिटिव बिकॉज इट डिड नॉट गेट decolorized, meaning cell wall was thick. If it got decolorized, so blue color is gone, it got decolorized, so which color will it take? That is saffron. That is saffron. First class. So the principle of gram staining, main step was decolorization. There are two main principles of gram staining, that is permeability of the cell wall, gram positive are less permeable, and integrity of the cell wall. Now understand this extremely well. If integrity of the cell wall is lost, अगर cell wall टूटी हुई है, integrity of the cell wall is lost, then even a gram positive organism looks gram negative, plain and simple. If the integrity of the cell wall is lost, अगर integrity नहीं है, then organism was gram positive as such, but cell wall टूटी हुई थी, so it got decolorized and it looks gram negative. Now your first question will be, why will the integrity of the cell wall be lost? We will see that when we see bacterial growth curve, when they are lag phase, log phase, stationary phase and phase of decline. In stationary phase and phase of decline, the integrity of the cell wall is lost. That is we will see it in bacterial growth curve. Please remember it then. This point is very, very important. Please remember this. So this was about gram staining. Next point. So I can now safely say that gram positive organisms have a thicker cell wall. That is obvious. We have already seen that. Teichoic acid, this is important. Teichoic acid is present in gram positive, absent in gram negative organisms, versus lipid, which is lower. Yes, Saptarishi, yes. Versus lipid, bache, which is lower in gram positive versus higher in gram negative organisms. Cell wall is thicker in gram positive, thinner in gram negative, you know that. Now, all cocci are gram positive. All cocci are gram positive versus all bacilli. Rohani, not concerned, but you're not concerned. All bacilli are gram negative. This is simple basic. I'll scroll. What we saw with respect to the principle of gram staining. Gram staining is important. So I'll give you time on this. There were two basic principles, permeability of the cell wall and integrity. Okay, fair enough. Now, all cocci are round, bacilli are elongated. All cocci are gram positive. We will see when we study bacteriology, we will start with our first chapter, gram positive cocci, that is staphylococci, streptococci. All cocci are gram positive, except which are the gram negative cocci, that is meningococci and gonococci. Except meningococci and gonococci. Very, very important, and we'll do them in detail as gram negative cocci. It's a separate chapter. It's the second chapter of our systemic bacteriology, gram negative cocci. All bacilli are gram negative. All bacilli are gram negative except McDonald's. Very right. Very, very right. Except McDonald. That is Mycobacterium TB or Mycobacterium species, anthrax bacteria. Next, Clostridium species. Clostridium. So all these bacilli are gram positive. Clostridium, diphtheria, Clostridium, Corynebacterium, diphtheria, Nocardia, actinomycetes, Listeria, and diphtheroids. and diphtheroids. These are the gram positive bacilli. So all bacilli are gram negative except McDonald's, Mycobacterium TB, anthrax, Clostridium, diphtheria, nocardia, actinomycetes, listeria, and diphtheroids. These are the gram positive bacilli. We'll be doing all this. Uh, कुछ भी नहीं, देखो कोई मैकडी वैकडी के चक्कर में तो साक्षी पढ़ना ही नहीं है, मैकडी केएफसी के चक्कर में बिल्कुल नहीं पढ़ना. वैसे व्हाट डू यू थिंक, इज ट्रम्प गोइंग टू रिड्यूस द टैरिफ्स? We had actually 2 back-to-back classes very soon. Normally we have a gap between path and micro. वैसे you guys तो didn't miss me at all. ये चीज़ तो fact है. You were too happy and satisfied with the next subject and नहीं प्रतीक्षा, मैंने सोचा कि गणपति पूजा भी हो गई, विसर्जन भी हो गया, so I'm very free. So let me come torture you guys with these names as such. I know that was sarcasm. But if we are writing this, of course you have to remember it. Firstly, of course. I know, Namrata, I know. Let's hope Trump reduces the tariffs and all. And even the Supreme Court of USA is saying, one of the appellate courts have said that tariffs imposed by him against all the countries are illegal. It is, it is in Supreme Court now. Trump is one of the most powerful people in the whole world at present. And yes, he is the president, firstly. And secondly, he is one of the richest guys in USA. So how big an idiot he can be now? Think of it that way. I know whatever we say, but he deserves respect. So, Rajita, hope so. Hope so. See, let's not get into politics. Yes, GST has been reduced, Aditi, 5% and 12. Aditi is from, I think, business background. नहीं तो हम डॉक्टर लोगों को GST वीएसटी का ज़्यादा पढ़ा नहीं होता. But coming back, the first stain was acid fast. The next is actually, Namrita, I so disliked it, yaar. China. But coming back, so there are, bottom line is, there are no permanent friends or enemies. It actually changes with respect to the circumstances, and I guess that is there in life also. So Ankita Bache, O is 0 only. Matlab, there is nothing from O. Next is the acid fast staining. The first special stain was gram stain. Next is acid fast. Next is हाँ, surely yes. Yes. वाह नम्रता, फिर तो one of my I have no idea why I'm sharing this, but one of my very close dentist friends is from a Bania family. They export all those lehengas and saris to whole of UP. So their only daughter, she has 2 elder brothers. They are into business. One is in USA, the other is handling the family business. The poor girl became dentist. And पूरी family को इतनी hope थी कि अरे अब तो हमारी बेटी इतना कमाने वाली and all that. But यार, Bania families are clueless कि doctor earning is way too less. So I hope the same doesn't happen in your family also. But her family was very disheartened कि doctor बना के तो गड़बड़ी कर दी. But coming back, we'll end up chit-chatting. So the first was gram stain. Next special stain is acid fast staining, also called as ZN, Zee-Nielsen stain, ZN stain. So in ZN staining, what is the technique first? So carbol fusion. True. Next is acid fast stain. That is carbol fusion is poured on fixed smear. It is poured on fixed smear. तो सबसे पहले हमने क्या डाला? What did we first add? Carbol fusion. Carbol fusion बच्चे it is red in color. Carbol fusion है ना, वो red है, वो red है. So organism will appear pink or red against a blue background. See, whenever we talk of any staining, let me see if I have this with me. Yes, I do. This is AFB positive. This is what ZN staining or AFB positivity looks like. Before we study the technique, look at what the slide looks like. The organism is pink or blue, is pink against a blue background. So first stain that we put was pink or red, that is carbol fusion dala. Then we decolorize it with sulfuric acid. We decolorize with sulfuric acid. We decolorize with sulfuric acid. For the uninitiated, ROI is rate of return, rate of interest, I don't know. We decolorize AFB with sulfuric acid. For Mycobacterium TB, what concentration of sulfuric acid is used? 20%. Versus Mycobacterium leprae is also acid fast. We use what percentage of sulfuric acid? 5%. We use 5% sulfuric acid as decolorizing agent. And then we add the counter stain. That is blue in color. We add 2% methylene blue. So basic principle is always the same, whether it was gram staining or acid fast staining. Primary stain dala, we decolorized it and counter stained it. So counter stain is blue in color. It is methylene blue, so the background is blue. हाँ, return of. See, मुझे तो full form भी नहीं पता था. Next, so background is blue in color. That is why the counter stain is blue, methylene blue. So remember that image. You will never go wrong in a question on this. You don't need to memorize it. You don't need to rectify this. Next, AFB positive organisms, they have high content of lipid. They have high lipid, fatty acid, and alcohol. They have high lipid, fatty acid, alcohol, and mycolic acid in their cell wall. So which are acid AFB positive? Mycobacterium TB, Mycobacterium leprae, and Nocardia. Nocardia, head of sperms, but they are also AFB positive. Nocardia, head of sperm. These three are commonly asked: Mycobacterium TB, Mycobacterium leprae, Nocardia. It is AFB positive and head of sperms. This is AFB positive. This was our second special stain. AFB positivity have higher lipid, higher fatty acid, more alcohol and mycolic acid. And lastly, the last special stain being Albert stain. We'll be doing this we'll see this again when we study Corynebacterium diphtheriae, also called as Klebsiella bacillus, Corynebacterium diphtheriae in detail. We will study diphtheria, not to worry, we use Albert stain for Corynebacterium diphtheria. These are the stains used in microbiology. Next point. So, bache, this gets us to morphology of bacteria. This gets us to morphology of bacteria. Before we start with morphology of bacteria per se, we've covered a lot of content till now. Let's have a small 2-3 minute break at this point. Nothing major. Small 2-3 minute break. Take a round, splash your face with water, this, that. Hana, but 2-3 minute break. We'll take a 15-20 minute break around 7:45. Is that okay? आज तो day 1 है ना? Did you have, नहीं Saptarshi, not at all. Just Albert stain, Corynebacterium diphtheriae. Nothing more than that. अच्छा मुझे ये बताओ, did you have any class yesterday or you had a free day? Now the schedule is slightly on the relaxed side. So if yesterday was off, then today to let us cover slightly more content. Can we do that? वो 11:30 वाला फंडा अपना. Today is day 1 now. We'll cover more content and we'll be very happy and peaceful the rest of the 3-4 days. है ना? So yesterday was PCT. अच्छा चलो ठीक ठीक है. अच्छा, give me just 1 second. I'll tell you how long the break is. I ordered something. Let me see if it has come or not. Just give me 1 sec. And if the food has come, we'll take a 10-minute break. Just a sec. Okay, so guys, let's do this. It's just 5-7 minutes away. Let's have a break at this point. Okay, 100%. AFP, I'll explain the image. Sort of kuch bhi nahi hai. This pink colored organism, this is AFP positive Mycobacterium TB. This is Mycobacterium TB. The background is blue in color. So primary stain was red. Then we decolorized with sulfuric acid. Counter stain was blue. Done. So let's have a break at this point. Let's have a 15-minute break at this point. It's 7:05 by, yes, Rashmi, yes. So we restart around 7:20. Let's restart at 7:20 p.m. on app. You know that well. I'll put a message before starting. हाँ बस अभी तो यार I just कुछ ले भी नहीं सकते ज़्यादा. आई थिंक मोमोज हैं, नथिंग मेजर, कुछ भी नहीं. वी द इलेक्ट्रॉन बीम इज टारगेटेड in electron microscopy with the help of circular magnets, nothing more than that. अवंतिका तुम पिटवाओगी मेरे को चिकन, वो भी गणपति पूजा एंड दिस दैट एंड ब्ला ब्ला. नहीं, चलो भागो, सब लोग भागो, एंड वी मीट एट 7:20 PM with our session on the. Done guys, done. Bye.